been too long, it feels like. Well, good afternoon, everyone, and welcome to today's COVID-19 update here at the Emergency Operations Centre. I'm here to share with you today some not great news, and I really want to highlight for Calgarians today the real importance for us to take personal responsibility and discipline as we move forward. Things are bad. And I know, like so many, it feels like we're almost through this, and we are almost through this. I got my shot the second I was eligible. I know many others have. But I think it's important for us to understand just where we are at right now in Calgary. I want to tell you two stories. These are two personal stories. So the first is that I have a friend who's younger than me. She got her first shot, but before it had a chance to kick in, she contracted COVID. She's now in her 6th day in the ICU in an induced coma on a ventilator. Younger than me, had her first shot. I have another friend on the other side of the world, a retired civil servant in India and an extraordinary poet who I keep up with on Facebook. She had COVID last year, and she recovered. And she thought that she was safe. And now she has the variants. She's on day 13, being cared for at home. She's doing okay. And as she said on Facebook yesterday, thankfully, her oxygen sats have not gone below 90. She's a retired civil servant. She was a very senior civil servant in India. This is not a poor person or someone who's indigent or a transient worker. And she said, but if my oxygen stats had gone down further, it's not clear that they could do anything. Now that sounds like it's really far away. And we're hearing about India on the front of the news every single day and how awful the situation is. Here's something I need you to know. The infection rate in India is approximately 200 people per 100,000. In Calgary today, it's 520 people per 100,000. It's twice as bad. And that's why it is absolutely critical for all of us to be able to manage this with incredible vigor and incredible discipline. And I know it's frustrating. I know it's frustrating when you see those maskless idiots in their protests coughing and saying they have bronchitis as if, and you say, well, then nothing's happening to them. I know it's maddening when you see pictures of your friends having birthday parties and putting stuff up on Instagram and you've been doing all the right things. It's maddening and it's frustrating. And I know for many Calgarians, this doesn't feel real. Maybe I don't know anybody who's had COVID. Maybe I do know someone, but it was pretty mild, and I'm pretty sure it'll be mild for me and my family and my kids. I got to tell you, in my neighborhood, I don't think there's a single person who doesn't know anyone who didn't die of COVID. There certainly is not a single family who's not been impacted by it in a very bad way. And now, it's across the whole city. For a long time, we could pretend that only the upper northeast and East Calgary had really high numbers. Guess what? The numbers are almost equivalent across the whole city now. These variants are scary, they're transmissible, and they're going far. So I really want to show you some numbers here. I'm going to start doing something I don't typically do, which is show some slides, because I really want people to understand where we're at. The first one is active cases in Alberta. So you'll see that back last spring, when we were so nervous and we were so locked down, that's the first wave on the far left-hand side of this page. Our second wave, around Christmas time, when we closed the schools and put in all these restrictions, you'll see how high that was. Our peak was on December 13th, 21,037 active cases. And you will see that as of yesterday, day before yesterday, we almost were at our peak and growing significantly. That's Alberta, but I want you to look at Calgary. In Calgary, next slide, please. It's just coming. In the meantime, I'll tell you that Alberta leads the country in per capita cases. We're nearly double the second highest, which is Ontario, and we've heard a lot about the challenges in Ontario. We're nearly double. And this week, Dr. Hinshaw told us that we have an unprecedented risk of transmission across the province right now. We're headed in the wrong direction, and we need to continue to pay attention. So let me show you Calgary. Can we get that up? Oh, they're not the same. Haha. See, Doug over here knows the score. He's got his slides up. I got the wrong slide on my side here, but luckily I know what it says. So when we look at Calgary, you can actually see that, in fact, we're above where we peaked in January 7th at 7,500 cases. Today we're at 8,800 cases, 882 cases to be precise. That was day before yesterday. And we are still climbing. So we're well above the peak and we're still going up. This third wave is much worse than the second wave. We're the highest in the province, and what we call the variants of concern make up the majority of active cases, 63% as of yesterday. We know a little bit less about these variants in terms of their spread and the level of protection we have against them, but they seem to be very, very transmissible. And our numbers just keep rising. And I remember back last summer, we had lots of math lessons. I did, and I tried to express them to others as well about the concept of exponential growth. So we're in a situation right now where the variance rise means that we can expect new variant daily cases to double down every 2.5 weeks. We're staring down the barrel here, folks. And you might say, well, yeah, but the problem in places like India is that the healthcare system has collapsed. And I don't want to scare people, but I want to tell you that when the healthcare system collapses, it collapses fast. Let's look at hospitalizations. So when you look at Alberta hospitalizations, you might say, well, this is okay. Even though we have all this transmission, people aren't really getting that sick. We had 921 in hospital on December the 29th and 643 in hospital this week across the province of Alberta. But look what's going on in Calgary. So you'll see that in Calgary, we actually have already surpassed the peak of the number of people in hospital. And it's important to remember that in our system, the beds are usually full, even when we don't have COVID. ICU beds are usually full. Our hospital system runs at a very high capacity usage. And thanks again, as always, to the extraordinary public servants, the healthcare workers who do that work every single day to keep us safe. But what you can see here is that our hospitalizations are up and we're seeing younger and younger people admitted to hospital, including my friend that I told you about a few minutes ago. And we also know that the long-term impacts of COVID-19 on younger people are very concerning. Cardiovascular, pulmonary, neurological systems. We don't know enough about it. So even though some young people don't get as sick as older people with COVID, we still don't want to get it. You know, I'm actually hearing some people say, well, I had it and it was pretty mild. Wouldn't it be better if everybody got it? Let me remind you about my friend in India. Had it, got sicker the second time she got it. I know these are anecdotes, but this is a very serious concern and we need to be able to prevent this everywhere. Let's look at the most serious cases, those in ICU and the intensive care unit. I have unfortunately had way too many family members in intensive care units over the years, and I know what miracles they can perform in the ICU. But in order to perform those miracles, they need staff and they need beds. The Alberta ICU admissions are very close to our peak, and if you look at the Calgary ICU admissions, which are up on the screen now, you will see that we are well above our peak. Here's the other thing. You need to take your shot. But vaccinations are not going to get us out of this phase by themselves. Vaccinations are the long-term solution. And once we get a sufficient portion of the population immunized, that's when we can start reducing all the restrictions. But we need to save lives in the time frame in between. And so it's really important that you get your shot the moment you're available. And I'm happy to see that on April 30th, which is tomorrow, They are increasing to the rest of 2C, which includes things like caregivers of people who are immunocompromised and includes first responders, including officially firefighters, though I maintain they are eligible now. They are officially eligible tomorrow, according to the province, and others. We will get to level D or level 3 soon, which is everybody else. Get your vaccine the moment you are eligible for it. And let me say to my fellow Gen Xers, way to go. I won't sing the Nirvana song, Here We Are Now, Vaccinate Us. Maybe I will. But I'm being told by the city comms people I'm not allowed to sing the Nirvana song. But I will tell you, way to go, Gen X, way to go getting your AstraZeneca shots. Let's continue that kind of enthusiasm and activity and make sure that we are all doing this. But here's the single most important thing I want to leave you with today. Do the right thing now. It doesn't matter what other people are doing. It doesn't matter the fact that you feel put upon because you're doing the right thing and other people are not. Do the right thing. Don't wait for government to tell you what to do. Don't wait for the province to put in more restrictions. Here's what you need to be doing now. You need to be doing the same kind of discipline you were doing last spring. That means stay home as much as you can. It means restrict your exposure to people outside of your immediate family. It means wash your hands. It means wear your mask. It means keep your distance. 6 cowboy hats apart. It means stay home if you're sick. It means get tested if you're not feeling well. It means get vaccinated as soon as you're eligible. And I don't think I need to tell anybody this, but it's a tiny needle. I didn't even feel it go in. It's nothing to be scared of. I was one of the lucky ones. I had no side effects at all, not even a sore arm. Friends of mine have been the same as me. Some of them have felt a bit crappy for a day. Some of them have felt like they wanted to get 12 hours of sleep. But every one of them after the fact said, I'm so glad I did it. It was so worth it. So all of that is what we need to do now. We need to practice personal discipline and responsibility. I'm asking you one more time how we can work together to flatten this curve. The end is in sight, but we're not there yet. And I want you to remember, when you remember the activities that you undertook last spring, I want you also to remember the community spirit last spring. I want you to remember the signs in the windows that said, we got this. It said, we're in it together. Because you know what? We got this. We can do this. We can get to the end of that tunnel. We just got to be disciplined in order to get there. And I know that all of us will be able to do that. So today I'm joined, as always, by Sue Henry, the Chief of Calgary Emergency Management, who's going to have some things to say. But I'm also very happy today to be joined by Deputy Chief of the Calgary Police, Chad Tawfik. I know that there's been a lot of questions, including from me, around enforcement. I know there's been a lot of frustration around people who are flagrantly putting others at risk. And the Deputy Chief is here to tell you a little bit about what they're up to, keeping officers safe, but also making sure that we are enforcing the law. Deputy Chief.
Good afternoon, Your Worship, everyone online and in the room here. Thank you for having me here today. As we anticipate and prepare for another weekend of anti-mask and anti-vaccination protests, I thought it'd be a good time to update you on the role of the Calgary Police Service and in enforcing the public health orders, as well as provide context on why it's not so simple as some may think. There's many nuances to the provincial legislation and other enforcement measures that require response from CPS and our partners that may not always appear acceptable or adequate to the public. We understand this and totally appreciate the frustration, but we also want you to know that enforcing the orders where and when it's legally and safe to do so, we will follow through. We know we are also very extremely frustrated with the blatant violations of these orders. Our officers have been yelled at, battered on social media, and have had them and their families targeted by individuals whose intent is to cause chaos and disorder. This is not okay. But these members continue to show up at the rallies, protests, and demonstrations, striving to keep the peace and keep our communities safe. They continue to accompany our partner agencies who are critical to the success to ensure that they too are able to do their work and follow through with the inspections that are necessary, or when required to, serve court orders for those whose reactions have been nothing less than outrageous. I'm extremely proud of these members, their professionalism, and the work they do striving to keep our communities safe and to keep the protests from turning violent and further negatively impacting members of the community. We continue to work with our partners in Alberta Health Services, with Alberta Justice, to try to address any gaps in the system around enforcement. And our officers will continue to respond to these calls, the rallies and demonstrations, and seek compliance. That's our goal. We want people to comply with the public health orders. They will, however, follow through with enforcement appropriately and in line with public and officer safety. We continue to focus efforts on those who are repeat offenders and organizers of some of these events, rallies and protests, that are impacting the safety of our communities. I'll be really clear. This is a systems approach. We are one part of that system, and we will do our part to hold those to account who are defying the health orders. We rely on the entire system to ensure compliance and encourage everyone to do their part in keeping our communities safe, which includes following the Public Health Act restrictions. And Your Worship, the numbers are very compelling, but not to everybody. So all we can do is encourage those to follow through and comply. We will get through this as a community, but it requires everyone to do so. Thanks very much.
Thank you, Deputy Chief Tawfik. The City of Calgary remains in a state of local emergency to help support the response to the COVID-19 pandemic. And I know that all Calgarians have continued to make sacrifices since last March, and we're very grateful for those sacrifices that you all have made. As the numbers have shown, we must continue to work together to prevent further spread of COVID-19 and to save lives. The city has continued to work with our partners to ensure that we're providing critical services to Calgarians, including ensuring people can get tested and providing access to vaccines. Just this week, we worked with Alberta Health Services to set up a new temporary assessment and testing site in the Northeast. The testing site will open tomorrow and will be at the West Winds Park and Ride lot at 6200 36th Street Northeast. This is a facility for those with COVID-19 symptoms or those who are close contacts of a confirmed COVID-19 case. This site is available for those with appointments only, booked through the AHS online booking tool. We are also working closely with the province to implement a rapid testing program for our teams who provide critical services to the City of Calgary. This program is another tool in our toolbox that we can use to ensure Calgarians continue to receive the essential and critical services that they need. Additionally, we have dedicated $10 million to support the provincial distribution of vaccinations to Calgarians. At the start of this month, we partnered with Alberta Health Services and the TELUS Convention Centre to set up the largest rapid flow vaccination site in Alberta. We're pleased to see this site up and running and its success, with thousands of Calgarians lining up for scheduled appointments, and as we saw in the last couple of weeks, some walk-in appointments for AstraZeneca. Between April the 10th and April the 21st, Alberta Health Services administered over 26,000 vaccinations, with another 26,000 appointments booked for this week. As well, The TELUS Convention Centre handed out over 121,000 bottles of hand sanitizer and provided just under 6,000 Calgary Transit tickets to those folks that were coming for vaccination. As a reminder, if you are taking transit, you can pick up 2 transit tickets before you leave, one to reimburse your ride down to the centre and one for your ticket home. Look for the attendants that are wearing blue vests on the site to help you with this assistance. There is also limited free parking available. If you do park, please remember to register your car. You can start a free 90-minute session at the pay machine or using the My Parking app. We are pleased to hear, as Mayor Nenshi mentioned, that the final 2 groups of Phase 2, the rest of Phase 2C and 2D, will now be eligible to book vaccinations starting tomorrow, April the 30th. We remain ready as the city to assist in any way that we can in the rollout of these vaccinations. We know that the province is still looking into what Phase 3 may look like, and we continue to advocate for our critical infrastructure services to be included in those rollouts if they have not already been caught in some of the other rollout phases. Although we're encouraged to see the number of people getting vaccinated, we cannot rely on vaccinations alone to keep us safe. The number of cases are the highest we have seen since the start of this pandemic. Keeping our neighbors safe and alleviating the strain on our public health system means we all need to do our part and follow the current public health measures. And please, when it is your turn, get vaccinated. Also remember to be cooperative. If you are working with an Alberta Health Services contact tracer, they're a critical part in the system, and they're providing important information to you and helping trace the cases. So please be polite and continue to work with these individuals. We do know that long, drawn-out restrictions like these can be mentally and physically draining for all of us, but if we follow the guidelines, we are looking forward to be able to open things up as conditions permit. With the warm spring weather, please remember to go outside, get some fresh air, but if you do, maintain your physical distance, wear a mask if you can't stay 2 meters apart, wash your hands, and stay at home if you feel unwell. Yeah. If you need support and resources, please access 211 to access these resources. You can also connect with 211 online. Stay vigilant in your efforts. Now is not the time for us to ease up. We're so close to having more of our population vaccinated, and we're getting closer to the end of the pandemic. We must do everything we can to keep each other safe and healthy. Finally, more important is the time for us to be compassionate, caring, and careful. Let's finish this strong. Let's finish this strong together, Calgary. I know we can do this. I'll now pass back to His Worship.
Well, thanks very much, Chief. Thanks, Deputy Chief. We'll open it up to questions now. Just before I do that, let me just say, look, it's okay to be frustrated. It's okay to be sad. It's okay to mourn all of those things we've lost. You can hate the Prime Minister. You can hate the Premier. You can hate the Mayor. Who would hate the Mayor? But that's just not relevant right now. What is relevant right now is keeping us safe. Write an angry email. Take it out on people in the next election. But for now, don't play the blame game. Don't say, well, this is only because of this or that. Focus on what you can do to keep everyone around us healthy. The future's in our hands, folks. It's in our clean hands. And I hope that people will continue remembering that. Let's go to questions now. Operator, can you put the first question through, please?
Kevin Nimick, CTV.
Hi there. Question for the Mayor. Between April 19th and the 25th, more than 1,200 parking tickets were issued by Calgary Parking Authority for people who had parked at the TELUS Convention Centre to get vaccinated. Oh. Are you going to resend these tickets?
This is news to me. I assume what happened there is that people probably didn't start their session, which we have to do to keep you in the system. So I will remind everybody that although there's 90 minutes of free parking, you do have to log in. Either using the app or using the Pay Plus machine. Certainly we can look at what to do about those tickets. I actually didn't know about that. Do you want to say something about that, Sue?
That is correct. We did have a number of tickets that have been issued out of the TELUS Convention Centre parking lot by the Calgary Parking Authority. And the majority of those tickets were issued for folks that did not start their parking session when they arrived on site. We have a great collaborative process for that 90-minute parking window so that you can park for free for 90 minutes. And there's a process between Alberta Health Services as well as the Calgary Parking Authority that if the lineups are longer, we are able to extend those parking times, but that can only occur if the patrons start that session. There is a resolution process with Calgary Parking Authority. If you feel like you have been issued a ticket in error, please reach out and go through that resolution process. Is there a follow-up?
Yeah, but the resolution process, as I understand it, if it's on ethical grounds, you have to actually go to the courthouse. So you might have to take time out of your job to go there. And we're talking about 1,300 tickets, and you know that all of these people are going to get vaccinated. So shouldn't there be some forgiveness here?
Unfortunately, that's not something I can confirm that all of those folks are going to get vaccinated. Some of those tickets, the folks were in place for a number of longer term hours. So it isn't something that I'm able to blanket say they were all headed there. But the Calgary Parking Authority does have a great process for being able to dispute those tickets. But it's critically important that people start their parking session when they arrive for their vaccination appointment.
Thanks, Sue. I should just add, this isn't, meter men and meter maids going wild. There's an automated enforcement system in the parkade, so unless you're in the system, you'll automatically be mailed a ticket. And to your point, Kevin, you don't have to go through the court process. There's a pre-process first, which is to contact Calgary Parking Authority, and I'll be in touch with CPA after this to make sure that they're very generous when you contact them, so they don't have to go through that whole court thing. All right, we'll go to the next question, please.
Jason Herring, Post Media.
Hey, this question is for the mayor. You talked a little bit about your communities in Northeast Calgary off the top, and about this new testing site that's going to be opening in the McKnight West Winds LRT parking lot. I'm wondering if you think that any other targeted interventions are needed to help any area of the city with spread.
You know, Jason, if you'd asked me that question a month ago, I would have suggested that we want to take a geographic-based approach to vaccination and really go to the hotspots. The problem is right now the whole city is a hotspot. So the issue is a bit different, actually, which is we are trying to take some of the work we've done with the wonderful Calgary East Zone Collaborative, who've been working in East Calgary, and expand that throughout the city so that people have access to these services. But really, that's the critical thing. I'm really happy about the new testing site because we were hearing stories of 3, 5, sometimes even 7-day delays on testing. And anything we can do, that's not an area we've been involved with before, but anything we can do to help on that front, we're very happy to do. But this is what I want people to really understand, that with these variants, this is not a Northeast Calgary. It was never just a Northeast Calgary thing, but it's not just a Northeast Calgary thing anymore. You know, deep Southeast Calgary is now almost the same as the North. Central Calgary is almost the same. And Sue is showing me a map, which I should have put on one of my slides. The entire city is dark red. The entire city is above the threshold. Every neighborhood in the city is well above India. Do you have a follow-up, Jason?
I think that's all for me. Thank you.
Thank you. We'll go to the next question, please.
Darren Krause, Livewire.
Hi, I'm not sure who wants to handle this question. For these anti-mask events, do we have a sense of how much spread, if any at all, are coming from these events?
I'm looking at my colleagues and they're shaking their heads. Listen, I can be a little blunter than they can be. And I will tell you this. These people are flagrantly violating public health. They're making each other sick. If you can stomach watching these awful videos, you'll see they're all coughing and hacking in these videos, suggesting they have bronchitis. Yeah, right. So now, never mind that they're making themselves sick. I think some Calgarians might call that poetic justice. They're making other people sick. There are people who just want to come to Prince's Island on a sunny Saturday afternoon when the weather is nice. There are shopkeepers on Stephen Avenue who've been forced to close their shops while these guys are marauding down the streets. They're insurgents. And we're one step away from really bad actions here. And yes, they're absolutely making people sick. Do you have a follow-up?
Yeah, I just wanted to ask, there is rumor that the city is looking at, or at least talking about, the closure of some of the outdoor patios as a measure to contain some of the spread. Is that something you're able to confirm?
No, I'm not able to confirm that because I'm not aware of it. I can tell you that as recently as this morning, I was having conversations with the Premier on what the next steps might be should there have to be other restrictions. And here's the interesting thing. Despite some of the rhetoric out there, we've never had a lockdown here. Never, not even last spring. And right now, this is far from a lockdown. But if the next step is in fact a lockdown and curfews, then that's a big step. And that's a conversation that we really have to have deeply as we understand these numbers better. I will say that there has been some spread on patios, not a lot, but some. So I do want to remind people of the single most ignored rule there is, which is this is actually the law, which is you can sit on a patio, but you can only sit on a patio with someone from your household. And I got to tell you, every patio that I've gone by, there's a lot of adult brothers and sisters who live in the same house hanging out on those patios. So please, please follow the rules. You know, I know of a case very recently where 3 senior Calgary business leaders were sitting on a patio having a drink. Well-known people, completely unaware of that rule or unwilling to follow it. And so remember that everything you do, you have to do responsibly, because even though patios feel safe, you're outside, there's a breeze, you got to remember that duration is an important thing. So if you're sitting with someone without a mask on for an hour, even though you're outside, we have seen cases of transmission that way. So we really even have to keep our good discipline outdoors. You know, look, I don't wear a mask when I go for my evening walk in the neighborhood because there's nobody else there. We're not asking people to be silly. But if you're going for a walk with a friend who's not in your cohort, even though it's outdoors, and you can't keep 6 feet apart, wear your mask. And if you are doing an outdoor gathering, up to 10 people is allowed, you still keep your distance and wear your masks. I had my buddy's 50th birthday party. We had a wonderful backyard event. And you know what? We just kept our distance and wore our masks. And it was fine. You know, we didn't have a lot of food and drink, but, you know, it is what it is. We got to see one another. And so these are the things to be careful about. And remember, I want to, maybe for this moment, I'll just remind people of some of the rules, which are, yes, restaurants are open for takeout and delivery, and please support local restaurants. They are open for outdoor dining, but outdoor dining means outdoor. It doesn't mean in a tent with the walls up, right? That's the same as indoor. And if you're going to be dining in a restaurant, you should be there only with members of your household, even though it is outdoor. One of the other ones that people seem to forget is there is, from the Alberta government, a broad work from home order. So if you're able to work from home, you should be working from home. And I'm hearing stories particularly of law firms and professional service firms who people are going in every day. That should not be happening. Everyone should be working from home as much as possible. You should be limiting your shopping and retail activity to essential items and reduce the length of those trips and the duration of them and the frequency of them as best you can. All of these things are simple steps that we seem to have gotten a bit careless about, but we have to remember those actually are the rules that are in place right now. Let's go to the next question, please. Oh, Darren, did you have a follow-up? I think that was only one question that I answered about 20 questions in.
No, I asked 2 questions. I'm good. Thanks very much, Mayor.
Thanks very much. Next question, please.
James Keller, Globe and Mail.
Hi there. A question for the mayor. I mean, you said that you've been talking with the premier about what might need to be done. I mean, do you think the province or Calgary in particular needs additional public health measures? I mean, we've been 3 weeks into this move back to step 1, and we've both slowed a bit, but there's still significant growth.
No, it hasn't even slowed really, James, and that's the worry, right? Because what you why don't you throw that slide back up, the Calgary active cases, slide 2, Doug? Because this is really evidence-based. This is not about power grabs or anything like that. But you look at this slide, right? And you realize that it was growing and well, there's actually, believe it or not, we're actually in the 4th wave. It's a little hard to see on this graph. But the third wave was happening in the summer, at the end of July. And we put in the masking bylaw at that moment. Actually, leave it up if you don't mind. We put in the masking bylaw at that moment, and you can see that it flattened. The second wave was growing and growing and growing, and you know that the province put in some frankly ineffectual restrictions, and I said, these aren't going to do anything. Guess what? They didn't do anything. But our peak happened shortly after we put in real restrictions. We sent the high school kids home from school and so on, and then it started to slow down. The nadir of the curve, which is still far above what it was in the spring, that's when we started to ease restrictions. And things shot straight up. I should have put that on this graph, those dates. And things shot straight up. And what we've seen since the imposition of those restrictions, again, is it hasn't changed much. And so I was speaking with a scientist yesterday who's doing some modeling, and she was suggesting that with the variants, even with vaccinations, without further public restrictions, we're still going to see that doubling rate every few weeks, every couple of weeks. And so that's a bit unsettling, I think. And so ultimately, I'm not here to say to the province, put us in full lockdown or do other restrictions. I am here to say that what we've got in place right now doesn't seem to be working. And if we think that this is only a race against vaccines versus variants, and as long as we get everyone vaccinated, this will flatten out on its own, well, that's like saying budgets will balance themselves. And we're not in a position in this exponential growth for that to happen. So all of that said, it doesn't matter. Don't wait for the Alberta government to do the right thing or to tell you what to do. Just do it and start moderating your own behavior. That's what's going to flatten the curve. So did you have a follow-up, James?
Yeah, I'm sorry to ask the same question again, but I mean, you're telling people not to wait for the province to do the right thing. Inherently in that, you're acknowledging that the province isn't doing the right thing. So specifically, what do you think the provincial government ought to be doing right now to get this situation under control that it isn't doing currently?
And I don't want to sound evasive on this because I'm not the premier. I don't sit in the emergency management meetings. I'm not Dr. Hinshaw. And I know that they are in good faith looking at what they can do. But I got to tell you, there's not a lot of moves left on the chessboard. That's the challenge. And what's really the problem is that people are getting relaxed and not even following the current restrictions. So I'm completely evidence-based. I'm not making a values judgment on what the right or the wrong thing is. I'm just saying what's happening now isn't flattening the curve. And we have to flatten the curve. So ultimately, let's at least follow the existing restrictions. If they end up being more, let's follow those. But let's go beyond the restrictions as we run our own lives, as all of us have been trying to do. All right, let's go to the next question, please.
Madeline Smith, Calgary Herald.
Hi, Mayor. This is a bit an unusual presser today. I'm sure there were times in the past in all of these availabilities that you've given that some charts were brought out, but I can't recall that happening recently.
I'm feeling very Professor Nenshi today. I got to bone up on those skills. I'll need a new job in 6 months or so.
So, I mean, what message are you trying to send with bringing this data out today? I know you're talking about how things are quite bad, and you talked to the Premier just this morning at a separate event. So what message are you trying to send to Calgarians, and what message are you trying to send to the Premier and the provincial government with what?
My message today really is for citizens, and that is we can't get complacent, and we have to act now because things are really bad. I think a lot of us don't realize how bad things are. I did a little quiz among a bunch of my friends and just said, hey guys, are we at, near, or above the previous peak? And everyone said, oh, we're getting to it. And I said, well, we're well above it. And they were all shocked. And so I really wanted people to know that. And look, I actually had these slides presented to me yesterday. And what I said is Calgarians need to understand this. Slap a City of Calgary logo on those slides, and Professor Nenshi will come out of hiding tomorrow. Because I really do think people need to know this stuff. Do you have a follow-up, Madeline?
Yeah, as well, and I'm not sure if Deputy Chief Tawfik wants to weigh in on this or if it's a bit premature, but is there still a discussion among council about changing the municipal complex bylaw to try to address the situation with protests happening there, sometimes during work hours? Is that something that's still on the table?
Yeah, that one's for me, but if Deputy Chief wants to say anything more about enforcement, I'll turn it to him. He's had a very easy press conference so far. Yeah, I have made it very clear to my colleagues at the City of Calgary that we have to protect the safety of the people who work in the building, the people who just want to buy a bus pass in the building every day. And, you know, the municipal complex bylaw was something that I strongly supported some years ago because I really do believe that the municipal complex, being Calgary's front yard, should be a place for people to express themselves. But here's the thing, we're in a pandemic and people are dying. So if we need to suspend some of the nice to haves, and I don't think this is a substantial issue of freedom of expression, it's just a substantial issue of protecting people's safety who need to use that building. And if we need to do that, it's something I'm absolutely willing to look at. Did you want to add anything, Chad?
It's a really good question around these demonstrations, and especially during work hours. Often they're on the weekends when fewer people maybe are around the complex there. But internally with the CPS, we are looking at our planning around how we respond to these so that we can ensure that we maintain a safe space for people who are coming and going from the facility while trying to retain that right to demonstrate. It's that fine balance that we always have to strike. But our members are very diligent to try to ensure to respond appropriately and make sure that those that attend do feel safe. And we are focusing our efforts around that moving forward.
Thanks. Can we go to the next question, please?
Tom Ross, 660 News.
Actually, my questions have been answered. I can't think of anything else right now. You can go to the next person.
Great. Thanks, Tom. How many more questions do we have in the queue, operator?
The queue is now clear.
Oh, just as I took my mask off. All right. Thank you, everybody. And let me just remind everyone one last time. The future of this pandemic, yes, government decisions matter. But ultimately, it is in our own hands. It's in our own clean hands. So let me remind you of all the things I've been saying since the very beginning. Clean hands. Practice good hygiene. Practice good discipline. Clear heads. Make sure that every single decision you make is through the filter of safety for yourself, your family, your neighbors, and your community. And most important, open hearts. A lot of people are very upset. A lot of people have a lot of anxiety right now. We got to look after everyone. We got to be kind to everyone as we move forward. So let me remind you one more time. Stay home when you can. Stay safe always. Be kind forever. And together we'll continue to save lives. Thank you all.